The 10th Amendment allows any state to preserve their own rights. And only the rights that are delegated to the federal government, as you know, does the federal government have. And we're saying this is one right that is preserved for all Georgians and is not delegated out to the United States government. And so if they want to impose some government-run health care plan, if they want to tax and fine individuals, large businesses, and small businesses, we're saying do it somewhere else. No thanks. Massachusetts passed a plan a number of years ago, completely apples and oranges, different than what we're talking about today. And they mandated coverage, and we're saying the state of Massachusetts mandated coverage. Frankly, with this constitutional amendment would prevent the state of Georgia or the federal government from mandating coverage on any individual or any provider, any business, and they could not fine us or punish us for failing to choose such a plan. That's a good question. Is Medicare unconstitutional? I don't know yet. We'll fight that battle when it comes before us, but Senate Bill 92 addresses that. I just mentioned it a few minutes ago. It's our desire to privatize as much of government-run health care that we currently participate in as we can, whether it's Medicaid or Medicare or Peach Care. Senate Bill 92 addresses low-income children that qualify for Medicaid as well as Peach Care, and says, okay, let's continue to give them government assistance. We're not taking that away. Frankly, we're using those monies as a financial scholarship to allow them to stay on what many consider to be a much better insurance, which is private health insurance. Doctors' reimbursements would be doubled because private insurance reimburses doctors about twice as much as Medicaid. No new cost to the state, and frankly, it's been scored to be over a $75 million savings from groups like the Georgia State University. We need to look at innovative solutions that can save the state money and will save the state money. We need to privatize industries that the state doesn't need to be involved in, and one of those, I believe, is Medicaid and Peach Care. And so that's the purpose behind Senate Bill 92, is to provide better access for low-income children who are being turned away from doctors because reimbursements are so low, and to save the state millions and millions of dollars every single year, and do it the right way, privatize it. There are a number of states. I was a part of a group that drafted the resolution in the constitutional amendment back at a meeting at the American Legislative Exchange Council in April. But as you know, by then we were already out of session. It's been introduced in 6, 7, 8, 9 states already, the constitutional amendment, and I know it's passed in the state of Arizona, and I think it may have already passed in Texas as well. So there are states states are teaming up. The citizens of states are saying, we've had enough. We're going to stand on states' rights, and if the federal government's going to force us to do something, then force us to do something. We're not going to take it because we don't believe it's in the best interest for the citizens of our state. We don't believe it's in the best interest of small businesses, nor our state budgets. We can't continue to have federal crack dollars forced down our throats, get us addicted to federal mandates, and then, and only then, have to put that burden on state taxpayers, whether we're reducing fees or increasing programs, or reducing programs. Currently, the Democrats' version of all their versions of health care reform, to my knowledge, the Obama administration as well as the Democrats in Washington, mandate, compel, force, participation. And if you're a business, there's about an 8% fine. And if you're an individual who chooses not to participate, I think the current proposal is a 2.5% fine on your total income. So there is a fine and there's a penalty, and they can present a plan. What we're saying is we have the right to choose not to participate. As individuals, as businesses, as providers, you can't force us and you can't fine us. We want to provide our own free market, patient-centered, wellness-focused, preventative measure plan. We have in Georgia. We have begun to do that. It's providing tremendous benefits and accessibility and more affordable health insurance for all Georgians, and we want to continue to do so.
What's the second part? Explain the second part in the author.
The first provision The first measure says you can't force us, and the second says you can't punish us or fine us. Thank you. The ultimate goal is better access. I don't know if we want to do we want universal access, but we want to have, I believe we want to have personally, I want to have a 300 payer system. 300 million payer system, excuse me, a 300 million payer system, which means we all participate. We all have tax benefits. It's all personally owned. It's portable. Your financial security is not at risk when you change jobs, move from job to job. You don't have your financial security for you and your family is not at risk because you own it. You're incentivized to be personally responsible. You're rewarded if you stay healthy by refunds of health insurance premiums, which is Georgia law today. And yes, you would have universal access. Frankly, there's universal access today. It's called the emergency room at your local hospital, which is paid for at taxpayers' expense in many instances, and definitely when private insurance doesn't kick in, or government insurance like Medicaid or Medicare.
So your Senate bill provides for all those things that you just rattled off?
Many of those things I rattled off are Georgia law today. Many people aren't hearing about it because, frankly, the guys standing with me have to put their own money on the line and pay for TV ads and coverage because it's not being covered out there by many people in the press. But Georgia law was changed in 2008 to give tax credits, tax benefits, to incentivize wellness by refunding insurance premiums when you stay healthy. We're the only state in the country that allows that to happen. Every other state, it's against the law. We've done we've passed a lot of good bills. We're the national leader in healthcare reform. Georgians are better off today, and we want Georgians to continue to be better off tomorrow, and they won't be with Obama's government-run healthcare plan, this public option, or any form of that. Socialized healthcare is not the solution.
You know, at one point they say that they're not going to force you out of your own doctor, but their own budget numbers tell us, their own Congressional Budget Office tells us that 100 million people will be forced out of their own private insurance right now and have to go to a government plan. So if you like Medicare or if you like the way the government runs anything else, well, then you're going to love this plan. I would suspect that most people don't like that. But again, this is not about universal coverage. This today is about one thing and one thing only, and that is the freedom of Georgians to purchase private health care. It cannot get any easier than that. We're simply telling Washington, D.C., we don't know what's in your grand plan, but we can tell you this. The one thing we're not going to stand for is for you to tell us as Georgians that we cannot purchase private health care. Well, we can ask our friends in Canada if that's eligible.
You want me to answer the question?
Well, Tom, we clearly understand this is not Canada. We understand this is the United States. We understand this is Georgia. Perhaps you're missing what we're talking about here today, and that is the freedom of Georgians to be protected by the state constitution to purchase private health care at any point in time, whether it be today under the Obama plan or whether it be under the next president or the next president after that. We're simply stating as part of the Georgia Constitution, we want to protect that freedom of people to choose to purchase private health care.
Under the current proposals today, if it passes, you can stay on your own personal health insurance until, here's the rest of the story. Listen up. Under the current plan, the rest of the story is your private health insurance goes away. Insurance is on an annual renewal, and once it comes up for annual renewal, it goes away, and then the only option is a government plan. Because that's their law. That's HR 3200 and the rest of it. I didn't write it. I would never force something like that down the throats of any American. But you can stay on your private health care plan until it expires at the end of the year, and that's the rest of the story. With that, thank you very much for being here today. We'll stick around and try to answer your individual questions. We really thank you for being here. We believe that this is the right thing for Georgia. We want to stand up for Georgians' rights, and we're joining here united to say, no thanks, leave Georgia alone.